Hi everyone, welcome back to Beyond Your Knowledge. So today we're going to be talking about Listeria Monocytogenes. And before we continue, I would like to share with you Psalm 115 verse 3, and says that our God is in the heavens and he does all that he pleases. Okay? So and then now Listeria Monocytogenes. Let's just talk about a little bit more about Listeria Monocytogenes. Well, first, this Listeria Monocytogenes, it is a gram-positive bacillus. Okay, now also it is a facultative intracellular organism. So that means inside of the cell. Okay, it is facultative, so that means that can survive in aerobic and anaerobic, so adapted depend of the environment. Okay, now this facultative intracellular organism has the ability to avoid phagocytosis, and so that means that can avoid phagocytosis, and if avoid the phagocytosis, so that's mean that can spread intracellularly. Okay, so that means that can spread intracellularly. This is Listeria Monocytogenes. Now there is, because these microorganisms is going to affect part of your tissues go inside of the cells, so that the immune system it can respond in a certain way. So which kind do you think that is going to work with this Listeria Monocytogenes, humoral or cell mediated? Well, in this case it's going to be cell mediated. Okay, so cell-mediated immunity is the one that is going to be working here with us. I mean, with this microorganism. Now, this one is going to. It is required to clear the Listeria infection, while the humoral doesn't play a role at all. Okay. Now, the Listeria Monocytogenes is the most common in patients when they have deficit on the cell mediated system. Okay, now which kind of patients could be deficits with the can have deficiency of the cell mediated, so low cell mediated immunity, so the patients are infants. Okay, infants, also elders, also patients that has an elders or elderly, yeah, also patient that has an HIV positive. Okay, or the patient that are receiving chemotherapy. Okay, see, this is basically some of those examples. Now Listeria has something interesting, because besides to attack any of those patients that has the low immune system, semi-mediated system, Listeria also has resistance to some microorganisms, and Listeria is resistant to cephalosporin. Okay. Yeah, so why it is why that has a resistance to cephalosporin? So it is due to the altered penicillin binding proteins. Okay, so because the cephalosporin, so basically we modify the penicillin. Okay, so the penicillin binding proteins, and then through this when this drug is modified, so or is altered, so the cephalosporin becomes resistant, because cephalosporin is working the penicillin binding proteins, but then become resistant to the patient that has Listeria, but it is susceptible to ampicillin. Okay, so Okay, let me just fix this here. So it is, oh sorry, is resistant cephalosporin is due to the modification or the modification, that's it. So but it is susceptible to ampicillin. Okay, so it's fine, give it to ampicillin. Now what else we can learn about all these things? For this reason, which kind of patient, when the patient got an infection of Listeria, so one of the diseases that can cause is meningitis. Okay, can cause meningitis. And so another thing that we can mention here is how does meningitis can present. So remember nuchal rigidity. So also the patient that has an infection with Listeria can present with fever. Also they can present with irritability, but those are not exactly that are just okay, this is the only disease that can cause this. No, it is not. But it is some of those can cause this. Okay, so irritability, let me just write it better. Actually it's with one L, irritability. I didn't know that. Okay, now also can cause Plio Psychosis. But what it is Plio Psychosis? Plio Psychosis basically is high levels of your white blood cells. Okay, now all those things, so when you see Plio Psychosis, when you see, I'm going to put this in red, so when you see Plio Psychosis, when you see irritability, when you see fever, we need to suspect meningitis. Okay, now then also they can have nuchal rigidity, all those things, but it is important they have those. Now let's see what else so we were mentioning about the treatment, that they are resistant to cephalosporin. Yes, so but they're susceptible to ampicillin. But why resistant to cephalosporin? Because that is a modification in the penicillin binding proteins. Now I would like to introduce another organism that they are also resistant to cephalosporin. Okay, let's just do it in blue. So there is a more organism, so more now we're going to do here, so okay, so and then we're going to see the organism one side, and the other side is going to be the reason. Okay, so the first organism that we're going to mention, just but quickly because we're already just the name, so Listeria Monocytogenes. We already talked about that one. Then the other one that we're going to mention, it is methicillin resistant Staphylococcus. So let's just write it here. So the next one is resistant. This is very important. And then one more inside of those. There are more, but one more for this reason that I'm going to give you soon. Okay, so this is the one is enterococci. Oops, sorry, that should be blue. Enterococci. So why all those are resistant? So the reason it is because so all those are resistant because resisting penicillin binding. So if you learn already Listeria Monocytogenes, so you already know why, because basically all those are in the same. Okay, so why? Yeah, because there is a resistant penicillin, but why penicillin binding protein? Because this one is modified, and then you get your cephalosporin. Okay, now what is the other one that is going to be cephalosporin resistance, and we're going to see right now. And this one, it is that doesn't has wall, but it is an atypical, and these atypicals, for example, mycoplasma, okay, mycoplasma and chlamydia. Okay, so let's see. Okay, let's see. I'm trying to look for a room here. Sometimes just yes. Okay, word. Well, chlamydia. There we go. Chlamydia and mycoplasma, they are atypicals, and they have a common characteristic, and it is that they don't have cell wall. Okay, so I think that basically this is the big picture here, all those things, and just keep in mind that it is important to keep reviewing this. So we're done. Thank you so much for watching, and God bless you. And remember, we can do all things through Christ who strengthens us.